You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Welcome to I Am Refocused Radio. Once again, we are here today, and today, man, we have a true honor having a returning guest, Dr. Ingrid Skop. She is OB/GYN and the Vice President and Director of Medical Affairs at the Charlotte Lozier Institute. Once again, we have a lot of news going on as Congress wrestles over budget bills and high stakes negotiations continue, including the grueling 21 hours Rules Committee hearing. One issue has dominated headlines: taxpayer funding for Planned Parenthood, and the broader, battle over abortion in America, with a lot of things going on with powerful Democrats pushing to expand welfare without work requirements, and also defend an organization under fire for both medical malpractice and political manipulation. The facts are getting harder to ignore. And we're going to dive a little bit deeper and further with our special guest today. So once again, I want to say to you, Dr. Ingrid Skop, thank you for your time today. How are you doing?
Thanks. I'm doing great. It's good to be with you.
It's a lot going on. It's a lot to unpack here because if you have been watching the news, it's kind of like firecrackers. It's like, which one are you going to follow? Because it's probably another story breaking. What are some real world risks that you've been seeing when it comes to botched or unsafe abortion procedures?
Well, what we're seeing in Texas a lot is the fact that women are ordering abortion drugs over the internet. They're delivered in the mail in violation of the law. And often these women have complications, especially since there's no testing being done to determine who is appropriate candidate for these drugs. And they're showing up to emergency rooms, sometimes hemorrhaging, often in need of emergent surgery. So really medical malpractice that these women are being given these drugs with no ability of the abortionist to follow up and to care for their complications.
And even more news from mainstream outlets like New York Times and NPR sounding alarms for serious problems inside Planned Parenthood. When you look at the growing concern about conditions at some abortion facilities, from your perspective, what kind of medical standards should be in place to protect women's health?
Well, abortion is a medical procedure. Of course, in almost every situation, it is not treating a medical disease, but that's another issue for another day. But because it is a medical procedure, it should be held to the same standards of every other medical procedure. But increasingly, that is not the case. The abortion industry operates outside of mainstream medicine. They do what they want. And what we see is that Planned Parenthood is willing to sue to overturn state laws that are trying to protect women. Outside of the states that have, laws protecting unborn life, a lot of states just have, they may not protect the young human until the time of viability, but they do have laws that require standards, that require having some kind of a facility standard or reporting complications so we know what's going on. And yet we see that Planned Parenthood wants to overturn all of those laws as well. So they want to operate with impunity without anybody giving oversight to the care or lack thereof that they are providing. And that has been quite a problem. And in blue states and in red states, women are being harmed by Planned Parenthood abortions. You mentioned the New York Times article. It is instructive for everyone to read because it is filled with egregious complications, descriptions of undertrained staff, of very poor quality facilities. And it also points out that Planned Parenthood takes in a tremendous amount of money. They take in about $2 billion a year. About $700,000 to $800,000 of that is taxpayer money, which, of course, as you mentioned, is what there's discussion about right now. In the wake of the overturn of Roe v. Wade, they took in between about $600 million and $1 billion in private donations every year. They have the money to have good quality facilities and to provide decent medical care, but the New York Times demonstrated they are not doing it. And instead, they're using that money to try to overturn state laws through lawsuits and to buy pro-abortion politicians so they can continue to operate with impunity the way they are doing.
And when you think about the role of parents and health standards, some states require parental involvement for minors seeking abortion while others don't. What's your view on how this impacts emotional and physical health of young patients?
Well, obviously, if you have a young woman who's in a crisis pregnancy, who better to help her than her own parents? So anyone who would say, let's keep the parents out of the loop, let's provide this girl with an abortion that may very well harm her mental health, and there's very, very good evidence, particularly in young girls, that this is often the case. And we know from international studies a woman is 6 times as likely to commit suicide in the year following an abortion than if she'd given birth. So to take the parents out of the loop on that really life-changing decision is such it's an inhumane thing to do, and yet Planned Parenthood is suing to overturn laws like that.
When you look at alternatives to abortion facilities, there are thousands of community and rural health centers across the country. Can you speak to the kind of comprehensive care that they provide for women that abortion clinics often do not?
Yeah, absolutely. There are so many other places that women can get the care that they need. And I want to point out, just looking at Planned Parenthood's annual report, like, you don't have to believe me. If anybody's skeptical of what I'm saying, open up their annual report and you will discover that 97% of the pregnancy services they provide are abortions. Many women go to Planned Parenthood thinking they're going to get counseling about options. What other choices do I have? And you can see that they're railroaded into abortions. Almost no Planned Parenthood does prenatal care. So to start with, these other alternatives, which are taxpayer funding for federally qualified health centers and for rural health centers, will provide prenatal care. It will provide pap smears. It'll provide contraceptive services. It'll provide what women really need. But when we look at Planned Parenthood and see what's happened with them over the years, what we discover is that every year they sell more abortions. Last year, they apparently sold 400,000 abortions. 400,000 American unborn lives were lost. And at the same time, their other services, including contraception, are going down dramatically. So they're not providing contraception in many cases. They're not providing well women exams like pap smear. They're putting really all of their focus on abortion. And I can tell you this from personal experience. I've been practicing obstetrics for 30 years. When I was a resident, I used to moonlight at Planned Parenthood. So I used to work there, and at the time, of course, I didn't provide abortions, but I would do well women exams, and really felt like I was doing some good. And I think a lot of people still have that image of Planned Parenthood. They don't realize how much the organization has changed. At that time, they were performing about 10% of the abortions in the country. Now it's 40%. So again, they're putting their focus on one thing only, and Americans are very torn about the idea of their taxpayer dollars paying for this. We all know how divisive it is. So these taxpayer dollars can be funneled to other, organizations that provide the health care that women really need. And I also would point out Medicaid health insurance, which, underprivileged women can qualify for. Almost every private doctor will accept Medicaid. So again, they don't have to go to a Planned Parenthood. They can come to me in my office. And also, I would mention that there are pregnancy centers in our country. They may not provide every service, but they are particularly designed to help women know what the other options are. How do I find support, material, financial? How do I apply for Medicaid? Those type of things, which is so important for a woman's choice, because we actually know that of women who are surveyed after abortion, 60% say they would have preferred to give birth if they'd only had more support, financial or material support. So that support exists. And if Planned Parenthood, clearly they're not telling women about that support if they're selling abortions 97% of the time. But these other organizations can help walk a woman through all of her choices and not just the non-choice of ending her baby's life because she doesn't have the support or financial or relationship that she needs.
And speaking of support, many women might feel that they are pressure or isolated when considering abortion. What can the medical community do to do a better job supporting women emotionally and physically through unexpected pregnancies?
Well, I think we, as a community, the entire United States needs to recognize this is really, for 50 years, even before, from the time of Roe, we offered this as a solution to women for their complex problems when 96% of the time women choose abortion for social and financial reasons. Well, let's offer them social and financial support. Let's help them with their relationships, because about 2/3 of women who obtain abortions do so because the father of the baby is not willing to be involved and to help them to raise that child. So really, society needs to be discussing these very difficult issues. It's hard to go backwards with our morality, but I really think we should try, because right now the promiscuous sexuality that so many women are engaged in, it's harming them, and they'll acknowledge it. And even Washington Post reporters and New York Times reporters and others who used to advocate for this are now recognizing, many feminists, wait a minute, this really didn't do us any good. And in fact, so many women are harmed. So these are other conversations we should be having. But I think just recognizing when women are in crisis, there's so many better ways we can help them and support them than merely to offer them the option of an abortion. And in the case of Planned Parenthood, mailing these drugs into states that are trying to protect unborn life, these are unsupervised, very dangerous in so many cases, abortions.
Last thing I ask for you is when you separate political opinion and what have you, the list is long, just pick your slide, and I'm sure this one's someone that might disagree or agree with you. When you kind of push all that to the side and you speak to the truth of science and what is really out there for information for women to have their options and understand fully what they can do, what do you hope that maybe will be opportunity for pro-life groups to continue to educate women what their options really are instead of the extreme points that we see on the news cycles?
Yeah, absolutely. We all need to be really digging into this issue to educate ourselves about what's really going on, because to say that this is what women need, I think women will tell us in the aftermath of this, that wasn't what I needed, and it was in fact harmful to me. And so I think that really all Americans of goodwill can come to a agreement on this. Let's don't have women have unwanted abortions. Let's don't let them have coerced abortions. Let's do all we can to surround them with love and care and empathy so that we can help them to avoid this damaging action.
Once again, been watching on Refocus Radio. I want to say to our guest, Dr. Ingrid Skop, appreciate you being here today. Like always, I want to say thank you for your time.
Thank you. It's always a pleasure to be with you.